Hi, my name is Chief Gary Wilson. I've been with the Denver Sheriff's Department for 22 years. We ran a survey for approximately 3 months, and it was close to 4,000 persons who had come through the jail in that period of time. 72% of those individuals did not have health care. When we began looking at this process, we were very interested in the continuity of care for our inmates. We had very strong programs inside the jail, but we were aware that these individuals would leave the jail and the services, whether it was mental health services or whether it was for addictions or any other health care needs that they would have, we realized that there was a big gap once they left the jail. And so prior to us having this connection with the Affordable Care Act, we had some individuals who have admitted that the only place they could get the kind of care that they needed was inside of our facility. We can all, I think, agree that that doesn't make a lot of sense. And today what we do is we actually use enrollment specialists that are employees of the Denver Human Services that works directly inside of our jails, and they identify individuals who look to qualify for the Affordable Care Act, and they sign them up or they begin the process here in the jail. And just right after their release, they sign their paperwork, and then that's how we make the connection. Well, to date, we have signed up well over 400 individuals who have come through our jail systems, and now it's linked to the Affordable Care Act. And one of the things that we're hoping to do here in Denver is to even grow our enrollment numbers by way of adding more staff to make sure we're touching everybody that we can. So I do know of individuals who have come in. They've participated in what's called our RISE program. It's a recovery in a secure environment. That program is really designed to deal with individuals who have addictions. And so we start them off here, and we get those connections made through the Affordable Care Act, and then they're able to transfer that care right outside into the community, which they're most vulnerable. We've seen numbers as low as 13% for individuals who have been coming back to the jail. And that's great because our average recidivism rates is about 54% just for the general population. It first starts with leadership from the top. It's going to take the head of the sheriff's agency or a jail administrator to really take a serious interest in this and lead it from the top. Once that decision has been made, then you've got to get the right stakeholders to the table, and it's a partnership in order for it to be successful. Here in Denver, what we did, we partnered with Denver Human Services, we also partnered with Denver Health, and also some of our state partners in the Medicaid area. We're also seeing a larger return on investment than we thought. We're already seeing close to $600,000 in savings in our medical care costs just in the last 3 to 4 months. We think that the Medicaid program is a huge contributor to the savings that we're seeing because we're able to offset those dollars that we otherwise would be paying by taxpayer dollars. And what we're seeing with that is that, these individuals are obviously by way of this new linkage, less people are coming in, so we're seeing savings that way. And we're seeing individuals who are doing better with taking care of themselves and actually using the treatment options that they have afforded to them. Well, anytime you can help someone else, that's really what we're about. And we're public servants. Our role here as public servants is to help others. And anytime you can meet that goal, you feel like you've got a sense of accomplishment.